Hello, dear everybody. So, I'm Dr. Sunanda Chavva. I'm a dentist, a postgraduate dentist. So, I just want to talk about mouth ulcers. So, first of all, what's an ulcer? Ulcer means the break in continuity of epithelium or that is mucosa or skin. So, if it's a big defect, that's if it involves completely epithelium, so you say it's an ulcer. If it's partial, it's called erosion. Now, there are so many types of ulcers. So, how are you going to diagnose a mouth ulcer? What type of an ulcer it is? So, as soon as the patient enters the room, you have to observe the patient. So, when you see the person might be holding the hand and he or she might say it's very painful or not painful, but I have something in the mouth. So, if the patient mouth is sore and severely painful or not painful but still I have soreness in the mouth, these are the complaints which the patient might tell you. So, first most common ulcers we should have in mind is traumatic ulcer or aphthous ulcer, like that. There are so many types of ulcers. So, I'm going to talk about only few ulcers which are very common. Now, when the patient comes to you, ask the patient to open the mouth and use mouth mirrors to check for the mouth ulcers. Don't use the probe, you are hurting the patient. So slowly you retract the cheeks and mouth, cheeks and the lips, and then you ask where the ulcer is, where the problem is, and you check for the ulcer. So in a traumatic ulcer, the ulcer will be very painful. Patient says it's very painful and all, and it's hurting a lot. So if you check, you can see a sharp tooth. That is, a tooth might be broken, so the edges of the tooth might be very sharp, or there might be a sharp prosthesis like denture and all. So, or else the patient will give history of trauma while brushing the teeth, or the person might have had a fish and the bone might have been caught in the mucosa, fish bone, and or else while playing the person might have fallen, or in elderly patients the tooth to elderly patients the tooth might have got treated and the edges might have become very sharp, causing ulcer on the tongue, cheek and all, tongue and all. So this type of ulcer is called a traumatic ulcer. So this traumatic ulcer, when you see, it has features of an healing ulcer. You have a healing ulcer type and a non-healing ulcer type. So healing ulcer means the body is giving response to the trauma in form of infection or trauma and all, healing ulcer. So they will heal once the causative factor is removed. The problem is corrected, so the ulcer will be vanishing. So for this traumatic ulcer, it will have a white epithelium. You will have ulcer around around the defect. You will find a white epithelium, white line, and then you might have a red halo around the ulcer. And then you might have some tissue tags, thread-like things coming out from the ulcer because of trauma. So at the edges. And when you see inside the ulcer, that is the base, so you'll have uh, white debris, and the shape of the ulcer will be irregular. It will not be very properly circular or oval like that, but it might have a irregular margins. So you use a word called as induration. So when you check for the ulcer, when you palpate for an ulcer, it is usually in a traumatic ulcer soft, or in chronic means for a long time the ulcer has been there in the mouth. There it will become slightly firm because of consistent trauma. There might be fibrosis. So you might have a slightly firm edges and base of the ulcer. So why should you see for an induration or hardening? See, because the traumatic ulcer, if it is there for a very long time and that sharp tooth or process has been causing injury for a very long time, it might become a malignancy, that's a tumor, cancer. So for that sake, and when it turns into a cancer, you'll have a hard or stony hard ulcers here. So in traumatic ulcer, how do you treat? First of all, the causative factor is a sharp tooth or broken tooth or a processes. Go for go for rounding off of the edges of the sharp tooth. If the tooth doesn't need root canal treatment, go for coronoplasty. It is called just rounding off the edges, sharp edges. So that's a correction. So if a process is there, correct the process. So the sharp edges of the process does not hurt the mucosa in the mouth. So you can do that, and then you can observe for 10 to 14 days, that's 2 weeks. And then if the ulcer is healing, you can leave it. And meanwhile, you can use some painkillers like paracetamol, which is called acetaminophen in Western countries and other countries. But in India, it's called paracetamol, otherwise also called acetaminophen. So you can apply that gel, local anesthetic gel, which might numb the mucosa, and before eating, if you apply, the pain will come off, will stop. So you can apply some lignocaine, or you can also apply for soothing agents like choline salicylates and all, symptomatic treatment and all. So or else you can give even brufen also, ibuprofen. Daily 3 tablets they can take until the pain subsides. So if the person has no induration and all, or you can do these things. And if while checking, while touching the ulcer, if you have hardening, you have to go for toluidine blow staining. It's used to check for cancer cells. So if the test turns positive, you have to go for biopsy and then manage accordingly. So in this traumatic ulcer, when you see, you have to always check if it's hardening and all. You have to always, otherwise also it's better to check for glands, lymph. It's called lymph nodes here and here and all. So here also neck. So you can check for the lymph glands, lymph nodes. If they are usually for traumatic ulcer, they'll be soft, painful. Or else if it's chronic also, slightly firm lymph nodes, you can, if you touch, you can feel like that. So if it's cancer, that's malignancy. So they'll be very hard, stony hard, and you have to be very careful. Immediately you should go for biopsy and manage accordingly, cancer treatment. Next, that's about traumatic ulcer. Next, going for herpes simplex virus ulcer or cold sores, common cold. You have nasal discharge and all, you have ulcers in the mouth and all. So those ulcers are called as herpes simplex viral ulcers or cold sores. If the patient says the ulcers are slightly painful with some signs and symptoms, like before they get the ulcers, they might get fever, malaise, body aches and all, just like flu-like symptoms and all. And then you might have a burning sensation in the area where the problem starts. So after that, you'll have a burning sensation in the vermilion border, that's in the upper lip and lower lip, upper border, lower lip, lower border. So you'll have lot of fluid blisters called as vesicles. There'll be many in number, and then they'll be very cropped means many in a groups. They occur like that, and then slowly the vesicles will burst out and the fluid comes off, and then you'll have ulcers which are joined now. So these ulcers called as herpes simplex virus ulcers. You have something called as latency in this case and all. Sometimes the person might not have prodromal symptoms. Simply the ulcers, vesicles might come and the ulcers might be produced. So it might be clinical, subclinical, and also without awareness the patient will be getting ulcers and all. And then cold sores, these are called cold sores and all. that sometimes some people get scared when they use viral ulcers because some people think that it is STD. Only in few cases, of course, it can occur in sexually transmitted diseases also, but most commonly they are cold sores. That's all. Nothing to worry. So you can give antiviral. You can give. It might have first time when it occurs, you'll have vesicles and all. Then after that, it might go off, and then after few days or after few months like that, it can come again due to stress, menstruation, and all. So or when they get exposed to other person who is having ulcers. So for the treatment, same thing what you do for traumatic ulcer, those medicines you can use. And then or else you can use acyclovir, that is acivir ointment, that's acyclovir antiviral, you can apply. Then you can take the person can take acyclovir tablets 400 mg daily 3 for 3 to 5 days. So this will prevent the recurrence. Again, it will not come for usually 6 months like that. After that, it might again come back, because it will be there in the nerve ganglia. It will come down along the nerve and it will cause vesicles and ulcers. So these are herpes simplex virus ulcers and all. That's cold sores and all. So in these cold sores, the person because it's viral infection, flu, you ask the person to take a rest, and they can take lot of fluids and all, tender coconut or else ORS and all. When rehydration, that is hydration and all. So when the patient has severe periodic recurrent ulcers, we have to. So that's about that's about herpes simplex virus ulcers and all. So there also the lymph nodes and all will be painful and all. So now we have to this acyclovir 400 mg three times will prevent the recurrence and all. Now coming to aphthous ulcer and all. So this it's a healing ulcer with red halo. Usually if you see very red colored ulcers, you usually think it's aphthous ulcer. That's correct. So that can occur due to B complex deficiency, stress, menstruation, so many factors and all. Usually students having exams will have that. Some girls, some people during menstruation will get. And then so many nutritional deficiencies, allergic, that is atopic constitution of an individual, that's allergy might be the cause, infection might be the cause and all. So same soothing agents given for traumatic or viral ulcers can be, those ointments ointments or gels can be applied, but acivir is given for only cold sores. So you have to check for, so you have to see if it is a very reddish, red halo, big halo, painful ulcers, then that might be small and cropped together, or very big one, so that it might look like a cancer also. That's called major aphthous ulcer. So these come periodically. So it comes and goes periodically and all. It will be very painful. Patient might bother or might not be worried about it. So if the patient comes to that, you have to go for B complex assay, see for B12 deficiencies, test for stress. History itself tells that they had exams and all, or they are having exams, they are reading lot of stress and all. So you can ask the history for all these things, and you have to check, do the tests accordingly. And simple management is same medication you have to give, lignocaine or choline salicylate and all. So if the person is stressed, some people might need even anti-anxiety medicines like diazepam and all. So that's that's little bit depends on the person's opinion and all. So supportive therapy like depends upon the patient whether he'll take sleeping tablets or not. Then counseling is very important before that. Psychological counseling, how the person should think, how he has to be strong, how he has to take up the exams, face the exams and all. So you can give that, and if it is vitamin B12 deficiency, give the vitamin B12. You can take B12 supplements and all. And then if it's allergic, go for antihistamine tablets like Levocet or cetirizine. Then and also all these remedies they can do. Now recently now we have corona infection. So do you get ulcers in corona infection, COVID? Yes, sometimes yes, you get. It could be the first sign or symptom also. Main thing is tongue, because they have some receptors which are very which are used by the COVID virus for causing infection and all. So these receptors are more in tongue. You'll have loss of sensation of taste. You might have loss of taste, smell sensation and all. Sometimes you might get some red area in the tongue that might later become a macule, that is called flat redness, and then it might later cause an ulcer. And also some people have reported about the ulcer and all in the COVID also. So if you have cough, fever and all, and tongue ulcers, and also loss of sense and all, or loss of sense of smell or taste and all, you have to go for COVID checking, testing and all. So you might get an ulcer of COVID and all. So the person might have some dryness of mouth also along with that. So yeah, so you can get ulcer in COVID and all. So they might have some fingertip redness also. Some lesions might occur on the fingertips and all. You might have bleeding points and all. So you have to see other things and all. And when you see an ulcer, history also is very important. When you see how did you get it, you all these questions you have to ask. History and all, because if you know all the causative agents, when you ask, you have to take all these causative agents in mind, and then you have to take history properly. That's very important, because seeing alone the ulcer, sometimes nobody can make out what type of ulcer it is. History is very important. You have to ask what they have done and all, how it has appeared and all. Okay, so that's about this. Is not a very complete presentation and all. So I just spoke. It's not a very complete presentation. So I'll meet you all in the other videos. Okay, thank you. Bye.